Hello and welcome to Doctor's Orders here at the Chrissy B Show. I'm Dr. Rob Hicks. Today we're going to be talking about stroke. This is how the brain is affected when its blood supply is cut off. You may have heard of it as a brain attack, which it's sometimes called. And in the UK every year there are over 100,000 strokes. And it's a medical emergency when somebody's having a stroke, so the sooner they get to hospital and receive treatment, the better, to reduce their chances of suffering permanent brain damage. In fact, stroke is the third most common cause of death in the UK, and that's why it's so important to be aware of it. Because when a stroke happens, people may be left with disability, they may be left less independent, they may in fact develop depression, as happens with a lot of long-term health conditions. And certainly their self-esteem may be hit very hard because of the disability that they're left with. That's why it's so important to identify the symptoms that may indicate that somebody, or indeed yourself, is having a stroke. And that's why we think about the word F.A.S.T. F is for face. With a stroke, one side of the face may appear to be dropping. The eye or the mouth may be drooping. A is for arms. People find that because of weakness and a loss of sensation, they can't raise their arms and keep them raised. And S is for speech. People who've had a stroke or are having a stroke may find that their speech is difficult to understand, that it's garbled, or that they can't talk at all. And T is for time. If you think that you or anybody around you is having a stroke, dial 999 and get that person to hospital as soon as possible so that they can get the urgent medical treatment they need, remembering that a stroke is a medical emergency. So what is it then that causes a stroke? Well, the two commonest causes of stroke is when the blood supply gets blocked off by a blood clot, but also it may be that there's a hemorrhage, bleeding in the brain. So when the blood supply gets blocked off through a process called atherosclerosis, this is where the arteries to the brain get narrowed, they get furred up by this fatty, yellow, gooey deposit called atheroma. Of course, blood can't get through, and that's why we often hear stroke called a brain attack. What causes this furring up? Well, smoking, too much alcohol, high blood pressure, high cholesterol, and diabetes. With the other less common form of stroke, where there's a bleed in the brain, a hemorrhage, it's often because the blood vessels are weakened, and the major risk factor for the bleed happening is actually high blood pressure, or medically termed hypertension. Other risk factors for a stroke include actually having a family history of stroke, getting older, and coming from a particular ethnic background, so being African, Caribbean, or Asian. So how do we go about trying to prevent having a stroke in the first place? Well, we try and eliminate those risk factors. Don't smoke, only consume alcohol in healthy amounts, and get yourself checked for high blood pressure, high cholesterol and diabetes, so that if you do have these conditions, then they can be treated. Strokes are also more likely to occur if somebody has underlying health problems, health conditions like an irregular heartbeat, something like atrial fibrillation. So in addition to dealing with the risk factors, the underlying health conditions need to be treated as well. Now, when somebody's had a stroke, well, of course, they'll still need to adapt their lifestyles to eliminate the risk factors. They will be offered medication to reduce the risk of further strokes and blood clots and narrowing of the arteries. They may even be offered surgery to widen the arteries so more blood can get through to the brain. And there are, of course, other therapies as well: physiotherapy, occupational therapy, speech therapy, and indeed psychological therapy may be necessary. So if you think that you might be at risk of a stroke, or you'd just like to find out more about how you can reduce your risk, then do seek the advice of your own doctor. And that's Doctor's Orders.